Hey, hello everyone. Good evening, good morning, good afternoon. We'll, Hi everyone. I can see some people joining in from YouTube, some from LinkedIn. Let's give everyone 2 minutes to come in to the stage. Hey, hi Dipesh, your live.
Hey, thank you, Ritesh, for adding me. Hello, everyone. Good morning, good afternoon, or good evening, depending on what time zone you are joining us from. Uh, Angie is also here. Hey, Angie.
Hello everyone. Good morning, good evening, good afternoon, everyone.
Great. Very excited to do this, Ritesh and Angie. We'll go through the patient onboarding journey. Let's give, a minute for folks to join, and then we'll get started.
Sure.
Yes.
Just common rules. You can just drop a message and wherever the portal you're using, maybe YouTube and LinkedIn, you can see the message. Any questions you can ask. We will answer at the last. If there's something, we will drop an email or something. So let's target to start at 8:05. It's 2 minutes.
Works. Just while we are waiting, I want to make sure that you know we will be going through an agenda where we'll be talking about the healthcare ecosystem and the challenges in the ecosystem, and we'll also talk about the healthcare journeys of for this discussion we have created the demo for you, which will talk about how a patient is onboarded and how care plans are given to a patient, and that's the demo we have in place today. So it's a short webinar of 30 minutes. Uh, Hopefully, we should leave a couple of minutes at the end of the session for question and answer. And as Ritesh mentioned, you can use the comments section, the chat section, on whatever platform you're using for questions. We'll be happy to answer that questions. So, a brief introduction about us. Ritesh, should I just go ahead and introduce ourselves till then?
Yes, let's go and start. I can see a couple of folks already available on YouTube.
Okay, let's get started. Hello, everyone. We are a Salesforce Rich partner. Today, we will be going through an healthcare journey or a patient onboarding journey in which there is a patient going through a journey on the hospital. When the patient reaches an hospital, what really happens, and we will be presenting a demo about that today. So, a quick round of introductions. I am the founder and CEO of Areya Technologies. We are a Salesforce Rich partner. Uh, and Angie, do you want to introduce yourself?
Yes. Hello everyone. Myself is Anjaneyulu. I am the Salesforce technical architect and having 13 plus years of experience and having Salesforce Health Cloud accredited professional certification as well. So I will be giving some kind of demo on the Salesforce Health Cloud patient onboarding.
Great.
Thank you.
Yes, you have the experts, health cloud experts here. So we'll be talking about that. So as I was talking about the agenda, we will go through the challenges in the healthcare ecosystem today. These are general challenges. What we have seen if you implement Salesforce Health Cloud, the success of it. We'll also talk about a specific journey uh, on the patient onboarding into an hospital, and then ultimately the demo. So let me get started. Uh, you know, as you can see here, there are hospitals or an organization, healthcare organization, and on the other side there are patients and caregivers. uh, there is definitely a lot of gap if the digitalization is not done in the organization. Now, yes, hospitals were definitely working when technology was not around, but technology is here to increase the efficiencies. So the relationship gap between the patient and caregiver is reduced if you increase the efficiencies. It also reduces the administrative burden, uh, and for a caregiver it gives a holistic view about a patient, and that's what is a gap in the organizations who have not adapted to the digital solutions. Now, disconnected systems are very costly, and let's I'm sorry, let's talk about a use case. I have went to an hospital. I have diabetes. Okay, I went to a doctor, which was a nutritionist and uh, also a diabetes doctor. I spoke to him about my health condition, and ultimately, he gave me a piece of paper saying that this is your rule book. Go follow it. Uh, I followed it for good 1 month, but it was just too much for me to just look at that piece of paper and just follow to that routine. So that's not efficient in today's digital world. I would want more than that, like a app sending me notification that this is my plan, this is what I need to follow, and uh, and talk about it so that I can see my progress digitally, uh, and the hospital should be engaging with me on regular basis. That piece of paper definitely is not engaging. So yes, so that's the challenges really, where a digital transformation has not taken place, wherein siloed data create inefficient processes. uh, Customer, so that doctor who gave me that piece of paper, he or she is not even aware of what's going with the patient, and could not give me another suggestions and keep tabs on what my progress is. And that's what the opportunity lies, to create efficient experiences. Now, where we have implemented Salesforce systems, we have definitely seen improvement in employee engagement. We have seen improvement in patient acquisition. We have seen adherences to the care plans. Now, care plan is nothing but that same piece of paper I was talking about. That's my care plan, which is available digitally for me to access, so that I can report back my progress. And based on my progress, more things can be given as a suggestion to me. So that's what we will look at today as a demo. But also, the people, the organizations who have implemented Salesforce has seen this kind of success. There are three personas which we'll be talking about today. One is a patient, second is a general physician or a doctor, and third is a care coordinator. As a patient, I would really love to have that I can schedule appointments in the system, and if not, I can walk into the hospital and ask the care coordinator to schedule an appointment for me. Of course, there should be an option for upcoming reminders of the uh, uh, you know appointments. Then I would want a seamless experience when I walk into the hospital, and ultimately my one view should be given. As a patient, my one view should be given to the care coordinator, where they see what allergies I hold, what is the medical condition, what are my care plans, without me telling them, hey, I am diabetic for like n number of times every time I visit. And that's what I as a patient is expecting. The care coordinator is expecting the same thing, saying that when I walk in, I just authenticate myself by giving my phone number or some kind of details, and they will know who I am and what I have and why I'm visiting for whom. So that's what is an amazing part here. And ultimately, some AI recommendations should also flow in, so that we really leverage the new world now with Einstein AI. Okay, so that's the journey we'll go through, and that leads me to handing it over to Angie, and he will showcase a great demo here. I'll stop my sharing.
Thank you, Dipesh, for a great explanation. Okay, so let me explain the patient onboarding and patient the journey in the hospitals. So here, the care coordinator, whenever opens the patient information, it looks like here. So in the Salesforce Health Cloud systems, we can see that life events. So based on the life events, also the care coordinators or caregivers can um, can come to know the patient situation on that, so that the life events are already here. And let's say the patient is taking some medications, those medications also are here. And appointments, so some kind of health conditions, what health condition, maybe some kind of so fevers, high temperatures, those kind of health conditions also can be captured, those can be displayed on the home screen itself, so that even care coordinators can try to give the appointment correct to the correct doctor. And here, so when the patient page opens, it shows the lot of information related to his date of birth and his emails, contact code, address, and it's like medical conditions, medications, what allergies they have. These all informations will be there. So once the care coordinator opens this patient's page, they can book the appointment to the doctor or physician using this button. So schedule new appointment case or schedule appointment. So I have already created. So here Rajesh Kumar is a patient, and I have created the appointment with Debashish Sharma, who is the doctor. And this doctor, when patient approaches this doctor, this doctor opens his page, and this is the appointment information we can see. So on the screen itself here, so Rajesh Kumar care appointment which has been scheduled. And once the, so mostly on the home page itself, doctor can see his appointments here. So directly I just opened from here itself. So now here he can see the patient details and some feed information. Let's say if care coordinator has created this appointment, and if he has some question to the care coordinator, he can send the messages and some kind of emails, and some kind of tasks also can be created. And he can see the details of this appointment for the subject. So Rajesh Kumar's care appointment, the description says what is the problems he is having, the patient is having, those can be in the description. And they can, he can see all the details of this patient. And this, the account name is nothing but the patient information. When he open the patient information, it opens like this. And here, so he can see all the information like life events, medications, and appointments, like health conditions. So benefits is nothing but insurance. Usually Health Cloud supports the insurance as well. Insurance information can be captured on the patient page itself, so that the doctors can suggest for the better treatment. And here, if you see that we have care plans as well. Let's say the doctor has diagnosed this the patient, and he identified some problems for the patient. Some he wanted to add some medications. Directly he can add here medications, or you can directly add from this page. So that here in this page, the doctor can see all the information, that is 360-degree information related to that patient. And here, so once the patient has the medication list and is going through the medication, and if he, the if he comes back and he wants to review the medications, so he can, the doctor can go and reconcile the medications, like how long these medications has to be taken, or if he wants to stop, they can give this reconciliation record. So everything is on the digitalization, every information. And let's say if this patient is having some problem, let's say whatever the illness he is having, for every illness or every sickness, there will be a plan, like hey, taking the medications, taking the insulin, or taking the injections, whatever it is. This is nothing but a care plan. So doctors can create the care plan directly, or they can enroll this patient into any existing care plan. Let's say if you take any diabetic patients, the diabetic patients will be more, there will be a common care program for any diabetic patient, so that if they want, they can directly enroll into that program, or else they can create a brand new care plan from here. New care plan. So we have already created some care plans. So what the doctors can see is they can directly go here and they can see that care plans what they are having. And if the doctor wants to go for this care plan, he can just click on this case page. Yeah, this is the care plan what we are having for this patient Rajesh Kumar. And for this patient we have some problems. And for those problems we will be having some goals. Let's say if you take any fever, if they have 101 degrees of fever, if they want to reduce that, there will be a goal, so that reduce to 98.5. So those, to reduce or to achieve that goal, there will be some tasks. So here I have high fever, or let's say high blood sugar levels. So to reduce that we will be having some tasks. Like, so if they want to go with that, they can have to create some tasks for each and every patient. There will be a care coordinator. That means care coordinator will be supporting the patient to take the medications or to give the injections and whatever it is. So for the each and every problem we can create a task here to achieve that. Let's say if I take the high blood sugar levels, they will see that provide insulin daily, and this has been assigned to the task owner Melinda Smith. So Melinda Smith is the care coordinator for Rajesh Kumar. Here, for any patient who is visiting the hospital, and the doctor will decide the care coordinator, and that will be updated on the patient record itself. So whatever the problems or any issues with the patient, they can directly connect with the care coordinator. So here the Rajesh Kumar, the patient, is having some task to take the insulin, to check that task whether they are taking every day or not. This task has been assigned to Melinda Smith, who is the care coordinator. Now, whenever the care coordinator logs in into the system, okay, so whatever the tasks are assigned as part of the care plans, those will be notified to the care coordinator here. So, so Debashi Sharma, who is a doctor, has created a task to provide the insulin for the patient Rajesh Kumar. So now they can check the task what has been given. Now here there is the care plan task, provide insulin daily to the patient is Rajesh Kumar. And now this task is related to this care plan. If they want to look, they can look into that care plan as well. And then if they have some confusion or some kind of questions related to this task, they can approach to the doctor by posting a question here to the doctor, or if they can have a question, or if they can post to any information. So here, so this is how the care coordinator can communicate with the doctor. So once this task has been completed, let's say till 30th of April, the insulin has been given to this patient as the due date is 4/30th, and then so they will mark it as complete. Or let's say if they want to follow the same medicine for some more time, what they can do is they can create follow-up task here. So that's how care coordinator will be working with the patients. And then another thing is, if they want to, if the care coordinators wanted to have another appointment with the doctor, so they can communicate here, or else they can directly go to the patient information and they can book the appointment as I have shown that, creating the button and then new appointments here. This is how it looks like, and they can also verify the care plans and their medical conditions as well. So on the update, on each and every day, they have to look at the patient and they have to get the information related to that patient. And here we have some kind of timelines also. So the care coordinators can use the timelines. That means the timeline is the way that shows that on what day what has to be done. It's basically the plan. So each and every day what has to be done for the patient. And another thing, so here we have a lot of care plans and cases has been created, and this task will be evaluated every day until unless these tasks are done. So the care coordinator will be working with the patient and doctors as well. So we have some kind of AI features in the Salesforce Health Cloud. Those are in, if you take any USA hospitals, they will be looking at the insurance. Even any hospital, they will be looking at the insurance information. For that, so verify insurance. This is accept button or reject. Let's say if care coordinator wants to suggest patient to take care of any illness or to go with any surgery or some kind of thing, if they want to check with the insurance how much it will be covered, so what they will do is they can just go here and click on verify insurance, and this will show that what kind of insurance they have and what, how much amount can be covered as part of that insurance plan, and how much amount the patient has to pay. That is verify insurance, which is Salesforce AI feature. And another thing is, this is pre-authorization request. As we know that if you have any insurance with any company, so they allow to take some kind of treatment before claiming that. So that is pre-authorization request also can be verified from here. And flu shot, this is one of the feature where the doctors or care coordinator can check if the patient is affected with any kind of virus like COVID-19 or any cholera or some kind of flus. If they have infected, they will suggest something on that. And this is the some of the features we have. So this is how the Salesforce Health Cloud will support for patients, how they can be booking the appointments and how they are going to visit the doctor. And then doctor will be assigning some kind of task to care coordinator to care to take care of the patient illness. So that is brief information. And if you take out this information, so in the patient card itself, you will be having a lot of information like his profession, age, and everything. So based on that, also the treatment will be changed. And again, there is one thing called benefits, as I said. So the benefits verification. So if they have any insurance plan, so the doctors can directly verify that insurance, so that how much the amount they have to pay or the insurance company can be paid. So that information also will be shown on the screen itself for the doctors. So as this patient doesn't have any insurance plans, so it's not showing anything. Yeah, that's thing. And another thing, the care coordinators will be having with the omni channel. They will be online and they can directly connect with the patients. So that is also features we have in this. Yeah, that's the brief demo. Thank you. If any questions, please shoot down.
Great demo, Angie. Thank you very much. Let me present my screen.
Yeah, thank you.
Great. If you have any questions, please shoot out in the comment section. Happy to take up the questions. But that was a demo, and hopefully, after my doctor implements the digital transformation, I'll be able to see my diabetic plan online rather than on a piece of paper. Great. So next demo is on the last Friday of the next month, which is 31st May. We'll be talking about the real estate use case of leads to lease. And this is a custom journey what we have built for our customers through a various experience of commercial real estate are sitting on top of Salesforce. So we'd love to show this uh, on the webinar next month. So if you are here, please feel free to follow our LinkedIn page or subscribe to the YouTube channel so that you can get timely notifications about these webinars. Thank you very much. We look forward to hosting webinars like this, and please reach out directly to us on this contact details if you are looking for implementing any health cloud journey at your organization. Thank you.
Thank you. Thank you very much.